In this video, you will understand the reasons for swollen feet with special focus on heart-related causes, diagnosing the underlying cause for swollen feet and treatment thereof. Anyone can experience swollen feet from time to time. It's common, especially after walking or standing for long periods or traveling for long distances, and one can often find relief by resting and elevating those tired legs. Sometimes, however, swelling is a red flag for a more serious underlying problem. Swelling or puffiness of the tissue directly under your skin, especially in your legs or arms. Stretched or shiny skin. Skin that retains a dimple after being pressed for several seconds. Increased abdominal size. If you have additional symptoms such as shortness of breath, difficulty in breathing, or chest pain, these can be signs of fluid accumulation in the lungs. Common medicines that cause swelling of feet include high blood pressure medications, non-steroidal anti-inflammatory drugs or painkiller medicines, steroid drugs, estrogens or hormone pills, certain diabetes medications. If you have congestive heart failure, one or both of your heart's lower chambers lose their ability to pump blood effectively. As a result, blood can back up in your legs, ankles, and feet, causing edema. Congestive heart failure can also cause swelling in your abdomen. Sometimes, this condition can cause fluid to accumulate in your lungs, which can lead to shortness of breath. Cirrhosis of liver. Fluid may accumulate in your abdominal cavity and in your legs as a result of liver damage. When you have kidney disease, extra fluid and sodium in your circulation may cause edema. In nephrotic syndrome, declining levels of protein in your blood can lead to fluid accumulation and edema. If you have chronic venous insufficiency, the one-way valves in your leg veins are weakened or damaged, which allows blood to pool in your leg veins and causes swelling. Sudden onset of swelling in one leg accompanied by pain in your calf muscle can be due to blood clot in one of your leg veins. Your body's lymphatic system helps clear excess fluid from tissues. If this system is damaged, for example by cancer surgery, the lymph nodes and lymph vessels draining an area may not work correctly and edema can occur. An extreme lack of protein in your diet over a long period of time can lead to fluid accumulation and edema. Several problems with the bones and tendons in your feet can also cause swelling. Examples include fractures, arthritis, and tendinitis. For people living with heart failure, behavioral changes can make a significant difference in their quality of life. By adopting certain lifestyle changes as well as getting medical treatment. Reducing the amount of salt in the diet. People should limit it to less than 1500 to 2000 milligrams per day. Also, make sure to include heart-healthy foods in your diet. Increasing or maintaining physical activity levels where possible. Exercise can help the heart function more efficiently, and it may also address other risk factors such as excess body weight and high blood pressure. Talk to your doctor about what and how much exercise with what intensity you can do. People with heart failure may find that their symptoms get worse during emotional crisis. It is also important to monitor symptoms. A doctor may recommend at-home blood pressure monitoring or regular heart health checkups. People with problems of the veins need evaluation and treatment of the same. For instance, heart failure is a life-threatening medical condition that a person cannot treat with home remedies or lifestyle changes alone. It requires the continued supervision and treatment by a cardiologist for the rest of their lives. Similarly, those with liver or kidney failure need further investigations to diagnose the problem and treatment. If left untreated, edema can cause increasingly painful swelling, difficulty walking, stiffness, stretched skin, which can become itchy and uncomfortable, increased risk of infection in the swollen area, scarring between layers of tissue, decreased elasticity of arteries, veins, joints and muscles, increased risk of skin ulcers. Edema in most cases may be self-limiting, but edema that doesn't go away, don't make your own diagnosis. With so many potential reasons for swelling, it's important to let your doctor drill down to the cause, prescribe the treatment you need, and help you get back on your feet as soon as possible.